We'll stop a couple times as we're going through and answer any that come up. Also, the GoToWebinar navigation toolbar on the right side, there's a orange button in the top right. You can click on that to minimize that and have the entirety of your screen. With that, I think we'll just go ahead and get going. Gary, I really don't have control unless it's a 15-second delay for me, so I'm gonna need you to drive.
No worries, Andy, I'll take care of it.
Thank you. So I'm with Bird Dog Technologies. I've focused for the last 15 years helping communities and networks, nonprofits, governments, states deploy and roll out systems to connect individuals to resources, to track service utilization, to understand the difference that the services that we're providing is making, and to support strategies utilizing technology. Today I am here with MapsPeople and Synergy Software Design. MapsPeople, we have Gary Wood, who is responsible for the US partnerships. MapsPeople has over 800 million square feet mapped today and is Google Maps' largest and most established mapping provider. We are also joined by Synergy Software. Mike and his team are on the forefront of scanning and modeling, image capture, and how to quickly take images and make them usable in a multitude of forms. They have been part of the team as we're figuring out how to take this to market and deliver this in communities in crisis in a very short time without requiring a lot of resources on your part. So our purpose here is very straightforward and simple. First, we are here to reduce the risk of spread. We want people to get from point A to point B as quickly, efficiently, without asking any directions. And that's one of the tools of navigation. We're here to protect resources, to reduce the spread, protect resources, but also resources in terms of time, appointments, congestion in our facilities, etc. And then finally, we're here to coordinate and share information. This is a platform that will allow communities and hospitals to coordinate and share information with the people who need it so they can access what they need when they need it. So as we look at the challenge, we know that there is a wave of new patients coming as a result of Corona. Our health system is not ready, and we are quickly moving to gather more resources and utilize the ones we have. In an average year, 30% of first-time visitors to hospitals get lost. That's under normal circumstances. And I understand that hospitals have been shut down to visitors, but as we look at the hotspots, as we look at staff and volunteer migration, as we're bringing in new people, as we're expanding health resources and adding repurposing facilities, there's a lot of opportunity for even people who have been working in a system to get lost as they're trying to identify where things are that they need to interact to do their jobs. Next slide. So just went ahead and really quickly pulled 3 examples of how facilities and healthcare communities are communicating right now to the public in terms of here's how to get from point A to point B, and these are actually good and they're useful and they're helpful in normal times. As it's static. As the situation is dynamic, which our response teams certainly have to be dynamic, we need the ability to work with these and change them. So this is how we are being provided information today, but over the past 15 years, people have learned that they can navigate from point A to point B. This is how we want to navigate, utilizing Google Maps. And so this is really important when we talk about MapsPeople being partnered with Google Maps. Google Maps already has the infrastructure in the counties, cities, states, everywhere that we want to be. They know where our healthcare centers are. They know where our colleges and our educations, universities are. They have all of the public space, but what they don't have is inside your buildings. So what MapsPeople does is partners with Google Maps to take you to the front door, and then MapsPeople actually provides you your own map inside your facility. So you now have the ability to control basically everything that's happening in your facility. So Google Maps takes them there, and now in your facility you have the ability to control points of interest. Where are rooms, resources, supplies, where are masks? I think in the demo Gary is going to cover, he's going to show how we can navigate people to masks. We can set what times are available for different resources. Additionally, you can manage the visibility and route permissions based on user role. So not only can you say where items are and what they are, but you can set who's going to have access to them and how they get there. So you can control patient access and navigation by symptomatic or non-symptomatic user. You can have user roles for staff and volunteers and quickly expose them to what they need to know and how to get there. Finally, this is to manage resource visibility, to support distribution and disseminate information through your existing channels as well as new channels. You are already communicating to the public. This can be tied in through our APIs and our SKDs to any existing applications you're using or email services or existing websites. You can publish QR codes that are attached to the user experience. So at an exam or at an exam site, I can click a QR code for symptomatic or non-symptomatic and be routed a different direction based on my user profile. And then you can automatically generate user-based web experience. So this automatically creates a website, which Gary's about to show us as we hop into the demo of the experience that you have set up that protects staff, users, and gets them where they need to go. Gary, I'm going to go ahead and just turn it over to you and let you just kind of introduce Google Maps and then walk us through the demo.
Thank you, Andy. So a little bit about MapsPeople. It is a company that's been around for 120 years, always doing mapping all the way from paper charts for ocean-going vessels and up to yellow pages in the 70s and 80s, things like that. So we have a lot of experience in how people use maps, how maps should be presented, and what kind of information is valuable on a map and how those people consume it. In 1997, we began doing web-based mapping. And finally, in 2009, became a Google Maps Premier Partner and are currently the only Google Maps Premier Partner providing indoor mapping. And we created our Maps Indoors navigation platform in 2013. So it's 7 years mature on version 3.0. So it is a solid, stable platform upon which to build this solution. And then, of course, we opened our office in the US a couple of years ago. So this is a Danish-based company, but we are full on into the United States now. We do support over 500 customers globally and have been over 10 years as a Google Maps Premier Partner with 125 years of mapping experience. We currently have 16 nationalities in-house, so whoever is coming to your hospital right now, chances are we have somebody that speaks that language and we can help craft the map and the solution into a way that speaks in their native language. If Google Maps supports that language and it supports 125 languages, we can support that as well and drive that in so that there's always a clear communication to everybody involved. The platform features several things, but we're going to focus a little bit more on the left side of this slide. So we're as part of a rapid emergency deployment solution, we're trying to just guide you all the way from wherever you are to wherever you need to go and to find the things that you need to find and understand where things are happening on the map. And we also want to focus on our content management system that gives you the ability to update the map in real time so that as things change, as the situation moves, you get to update the map, move points of interest around, and make sure that you're communicating the most current, the most relevant information to your end users. Now, that doesn't mean we eliminate the ability to do things like use our SDKs and integrate with other things, or use some of the data analytics that we have. We can still talk about those, but because we're focused on a very high speed delivery right now, we just tend to focus on the left side of this equation, although you get everything that we offer. One of the things I want to mention, and people think about why would I use a map, and that's because most information has a location component tied to it. And these are headlines I've pulled from the last roughly 4 days, where a union representing healthcare workers suddenly discovered they had 39 million N95 masks. They knew they had them, they just didn't know where they had them. And it took them a while to locate them and so that they could get them in use. So it's really important not to know just what you have, but where it is. There are facilities that are changing. Emergency hospitals being constructed in Central Park, the Javits Center being repurposed into a field hospital. Even if I've been to Central Park, even if I've been to the Javits Center, I've never been to the Javits Center or the Central Park as a hospital. I don't know how that's laid out. I don't know where I should go with that. And people are flying in, people are being moved around to try to help support staff as they do this. They've never been to these areas. So where do they go? Where do they find the things that they need to find? How do they get the things that they need to get and interact with the people they need to interact with when they've never been there? And not only that, whatever information is being disseminated is probably stale by the end of the day. When they were setting up the Javits Center, there was a chart flipping on the news from the authorities that was just big placards. They would flip through them, and you know that situation evolved very quickly. So the maps they had are out of date. They're not able to keep these updated and keep them disseminated out. So when we talk about a map, it's not just going from A to B. It's also understanding what's going on around you and developing situational awareness and communicating that clearly. And that's where a map serves as probably one of the most state-of-the-art communication tools we can deliver right now in this situation. So I'm going to show you a little bit about how we do that. I'm going to give you a demonstration of that. I'm going to jump over to our demo solution that we put together for this. And what you're seeing here is a hospital in Florida that we mocked up as a demo. And it's just a basic hospital map. But what I can do is I can say, you know what, I need to go to a test center. And then I can find the test tent. And it pops up for me, gives me some basic meta information around that. I can add more if I want. I can get directions to that. And let's say I'm coming from home right now. And you can see what that's going to do is give me the driving directions right now to get over to this tent. And I have the directions right here down the left side of that to give me step-by-step instructions on how to drive over there and how to get into this test tent. And that's, obviously extraordinarily important to people who are trying to understand where do I need to go to get my testing done. But once I get to this test tent, I can do things like I'm going to say, wow, you know what? I tested positive. I need to go into an exam room. So I can look for an exam room. I can walk away from that test tent and go to the exam room. But what you're seeing right now, I can't go in. Why can't I go in? That's because it's only for staff. If I'm a symptomatic patient, then I take this route and it walks me in. So that's the example of user roles in there. Asymptomatic patients and just staff will never get walked into this unless we want them to. But now I can walk straight into the hospital and into the exam room that's been assigned to me. If I was told to go to the exam room on level B1, this is the one I've been directed to. I can find it and get in. And I've marked on the map also the coronavirus areas so that people know when they look at this map, this is the area that's for contaminated use. If I go in here, I need to take extra precautions. And that way I understand exactly where things are on the map, where things are in my world, what kind of risks are associated with this, things like that. And I understand exactly what to do. And if I'm asymptomatic, like I just marked it, I can say, I'm in the exam room, but maybe I want to go to the cafeteria. And it's going to tell me that I can't do this. I'm symptomatic, but as a member of staff, I can do this. Let me pick a different cafeteria. And now it's telling me as a staff member, I can take this break, take the stairs, go up and head over to the cafeteria. Asymptomatic patients would never get this route, or symptomatic patients would never get this route. You can see now, no route found. You cannot get out of this area if you're symptomatic. So that is the way it works in a nutshell. But let's say I'm a staff member, I'm in the exam room, and I'm looking for N95 masks. Where do I go to get N95 masks? I can say, oh, there they are. That's where I've got them stored right now. I've got them in this closet over here. Now I know exactly where they are, and I can go and get them. If I need directions from the exam room I'm in, let's change myself to staff. And now it can walk me through to those. So that's the way I can communicate this information and get these things disseminated out. Let's talk a little bit about how I communicate the most recent information that's available. As I go down into this map and I look down here, I can say, wow, you know what? I have some masks over here, but that's not really where I need them. I know that I need them actually over here in this area. So I've moved them over, I save it, and now the map is updated for everyone that's using this application to know this is where I go to get the new masks. But let's say I've got some more masks that came in, and I'm going to drop them in a closet over here. I can say, pick my N95 masks, create. Now I've created a second drop-off point for the masks that just arrived. So I can begin distributing them around the hospital venue, and I can provide information immediately to everyone to know where these things are. Ventilators, masks, whatever equipment I need, I can start throwing these on the map and communicate those.
And Gary, I want to piggyback on that, and just because of the partnership with Google Maps, we have the ability to manage this and provide this management across multiple locations as well.
Right, we're showing one location here, but if you have outlying clinics, you can do that as well. And the way we do the route access and manage that so that you can do that live on the fly, you can see I have blocked out a few areas here, all the red marked areas, the icons on it. Those are restricted areas. No one can come in here unless they're a member of the staff or they're a symptomatic patient. Asymptomatic patients would never be directed into here. But I do the same thing, like this is where the elevator is. Only staff get to use the elevators or the stairs. This is the one that takes me to the stairs. I've limited those to staff only. And I've also come up here and said this particular route right here is closed for everyone. I don't want anyone coming in from the hospital into this area. I want to control access to come in through this front so that I know who's coming in and control the crowd flow. And that's the way I can do this. And I can change this on the fly. If I want to say, okay, you know what? Let's allow staff to come in here. I can save that. And now staff will see the map and see updated. This route is open to you now for you to come in here. Patients of any kind are not allowed. And that's the way I control and communicate where people can go and how they can find their way around within the hospital so that they get the most efficient route without having to interact with others and potentially contaminate anyone that has not been exposed already. All right, that's what we're offering in the red solution right now, is the ability to do this. Okay, any questions about that? Great. It's Google Maps, so it's really easy to understand, really easy to follow. It's not hard because there are a billion Google Maps users. We've all seen it. This is not something that's hard to demo or hard to understand. It's very quick and very easy. Let's see if I get the presentation.
Gary, there's one question about security. Is the solution secure or HIPAA requirement? Or are there any HIPAA requirements?
There are no HIPAA requirements because we're not tracking personally identifiable information. There is no way for us to go back and connect anything, any search, any route network that you pulled up to an individual. Everybody gets their own unique session ID every time they use the solution. So even if we wanted to, we can't go back. And if you integrate with this solution, it's all done at the UI layer, not at the data layer. So we never actually touch your data, and it never actually goes over into a Google server. It all stays right with you under your control.
Thank you.
Okay. Andy, I'm sorry, I'm trying to put this back in presentation mode, but it is just, there it goes. It was not cooperating. So what we're talking about here, it's everything that we offer. We're putting it all on the line. So there's no feature that's not limited to what you need. We're just limiting the scale of this so that we can go very quickly. We have a number of potential customers that want to use this. So we're limiting the scale and the scope of this just so that we can go very, very quickly. If you genuinely need more than 100,000 square feet, please contact us and let us know, and we'll work something out to get that going for you. The annual subscription, we're doing a 12-month subscription for $3,000. That's what we're looking for to get this done. But we're not looking for that right now. If you say go, we will start going right now. We will settle this out later when the time is right to do that. But we will just get flying on this and get this working for you as quickly as possible.
Yeah, and Gary, thank you, and also want to just thank the MapsPeople leadership team. Really, this Maps Indoor Red is a focus on getting this out and deployed in 10 days to communities who are in crisis or preparing for crisis. And so we want to get it in on the priority areas that you identify as quickly as possible, and then work with you to identify additional areas that are going to strengthen your response. To get this actually going, to talk through what are the steps and what do we need to know from you first, I just need someone to I need you to raise your hand. I need you to let me know that you want to do this. Let me know the total number of indoor square feet that you expect to implement, number of different locations, total required floors. That's going to give us an idea of kind of the complexity of the project, and we're going to take that and schedule a call with you for the next day. It's going to be a web-based remote meeting. We can get a lot done remotely. The entire building that you saw, the demo, we built remotely. So we can work with your team to handle that. We want to take a look at what you have and see if there are any additional facilities that need to be mapped. So maybe there are transitional facilities, maybe there are facilities you just can't get your hands on in the confusion that you need floor maps for. If there is a need for us to get there in person to fill the gaps for your map strategy, we have the ability to do that with our partner Synergy, who actually wasn't able to get on the call today. They were locked out. But with our partner Synergy, we can get there and incorporate any additional square footage by the time the map's being delivered on day 10. So after step 2, that the web meeting, MapsPeople and the team starts immediately configuring and building your maps and putting them in there. If necessary, we're collecting on-site scans as well, and then by day 10, we're actually publishing and reviewing the map with you to go live. And so at that point, we're going to be also pushing you forward in the dissemination strategy and how are you connecting this to your populations and making it accessible to them. So all of these things are meant to be together in a very rapid fashion to turn around. So I do want to talk just a bit really quickly about the scanning step as well. So if you do need to incorporate floor plans and locations that don't exist, we're going to get started with you with what you have. But if we need to get on site, we're going to identify that in that first meeting. And we're going to identify additional mapping requirements that you need. We're going to look at what they are, and then we're going to build a schedule. We're going to get there on site. And for your side, you should really expect maybe 2 to 4 hours total of us on site. We have the latest technology in laser scanning, which allows us to literally run through buildings and get very accurate models. With the equipment we use, we actually don't even need to go inside. We have the ability to actually hand that to an administrator or somebody with the proper security credentials who understands the building and have them walk through so that we don't have to A, cause a security disruption for your team or any additional complications, and B, we don't really want to send people from contagious area to contagious area and add to complications. So we're actually, when we get there, we're going to laser scan from the parking lots to the front doors, your major areas of ingress and egress. We're going to have the scan the corridors and main areas to get the floor plan, and we can do that with your staff, as we said. And then we're going to review the output right there to make sure we did indeed get what we needed. Once that's confirmed, we're able to leave you guys and format the maps, push them to MapsPeople for inclusion in that 10-day target. So if scanning is necessary, this is separate from MapsPeople. The MapsPeople platform, $3,000. We'll take what you have, get it going with the team right now if we need to scan. And if it's under 50,000 square feet, we can do it in $2,500 and have it turned around in 5 days. Up to 100,000 square feet, we can have it turned around in 10 days. So basically, we'll just figure out what you need and add it appropriately. For the scanning, we're primarily able to get on the East Coast right now. We're rapidly expanding that footprint. Yeah, so look forward. So those, I just want to be clear, they are very separate. We can do MapsPeople anywhere across the country right now. Scanning, we can service specifically in the Northeast right now. I think any more, Gary, were there any other questions as we hit the 10:30 mark?
Yeah, there was a quick question about hardware purchases. Do I need any hardware to implement this solution? And the answer is no, you don't need any hardware to implement this solution. This is all cloud-based and software-based. So it will be done by us and hosted in our cloud. And then all you need is a web browser or a mobile device to access the solution.
Okay, and I'll point out there is a handout on the side that you can download from this GoToMeeting. It is the presentation. The QR code on the presentation, if you scan that, will take you to the demo map that we were playing with today. Additionally, it has Gary and my contact information. Reach out to us right away. We would like to get this in your community, university, city, or hospital right away to help you coordinate your response. Also, we are doing a number of these webinars, offering them most days in the coming weeks. You can visit our site to register for any of those. Thank you so much. And thank you, Gary, and have a wonderful afternoon and stay safe.